We're all dressed and packed and ready to go.
People.
Well, that's just about it.
Patients from all parts of the world. Packing up and heading here. All in search of the same thing.
So we found ourselves in Delhi. What we really wanted to know is, where are all these patients congregating? You know, there's no question that medical tourism is very popular. If you Google it, you'll find more than 5 million results. $60 billion will be spent on medical tourism this year, and in the next 2 years, $100 billion. Came here to Max Hospital. We want to find the patients.
My name is Sandra Justina.
My name's Hamish McLeod.
Behind these faces are very different stories.
I'm
from Nigeria.
Home for them is Nigeria, Jordan, the United States, Afghanistan, the United Kingdom. But this is the common ground. A hospital in India. All of them here on the very same day for surgery. But why leave home? Some people don't have access to medical facilities in their own country. Others say they're tired of waiting, sometimes years, for treatment. For most, it is simply cheaper.
Patients come here for all sorts of different reasons, but what we know about Sandra is that she absolutely needed to have this operation. It was going to save her life. She came all the way from Las Vegas. Let's go meet her. Hello.
Hello.
Hi, how are you? Sandra, nice to meet you.
Sandra Gustina has been waiting more than 3 years for surgery to treat her atrial fibrillation. Until now, she couldn't afford it. She was told she would get a bill for $175,000 in the United States.
How much is it going to cost here, Sandra?
It will be under 10.
So $175,000 versus $10,000.
Right.
Had you ever left the United States before this trip?
Not too much.
Her story is typical. On average, the cost of some operations can be 10% of what they would cost in the West. So no surprise, some of them are venturing beyond their borders for the first time to get medical care. What they often find is a new culture, a new language, but also a new kind of patient experience, a balance of Western medicine and Eastern hospitality. At this hospital, they're catering to the familiar tastes of home.
So what do we have here? We have Chinese food?
We have Chinese, we have, the Indian, then we have the continental, and of course the Arabic.
Arabic food as well. Well, why is this important to have food specific to the different cultures?
We have patients coming in from around the world, and when patients are away from home and sick and away from their friends and families, food is something which really binds them. So they actually look forward to real authentic food.
Okay, so the food is good, but of course it's the quality of medical care that really matters. I scrubbed in on a few operations while in Delhi to get an inside look. First up, ablation surgery for Sandra's heart.
So Sandra, how you feeling?
Good. I'll be glad everything's fine.
You've been a little nervous.
She's been a little nervous, but she said one of the things that helped her is that her doctor back home has been communicating with her doctor here in India. It gives her a real sense of comfort. You ready to see the inside of your heart? Take a look over here at these images. What you're looking at is her beating heart. The catheters are going in. They're about to do the critical part of the procedure. We're going to check in with Sandra in a second, but first we were curious, how does a hospital like this take care of patients from so many different countries?
Most tourists book their operations online with the help of a medical travel planner. Companies like Planet Hospital facilitate the whole trip, from booking the world's top docs to the promise of upscale accommodations. Wi-Fi in your room, access to food chain restaurants, coffee shops, even a book cafe, all in the hospital lobby. They also have a 24-hour patient concierge.
We don't say no to anything, from giving you a cell phone, helping you in the hospital, taking you out, go shopping, go sightseeing, arranging tours, anything and everything.
Patients say it's like tacking on a mini vacation to their major medical operation. But with all this personal attention, high-tech machines, highly trained doctors, how can the price be so much cheaper?
I think we keep our administration costs very low. We negotiate our machines very, very hard. I get paid less than a tenth of what a neurosurgeon in the United States would make. Our personal costs are much lower.
Critics of medical tourism say what appears cheap for Westerners is often not even affordable for locals. Most Indian natives rely on the public health sector, which some say lacks basic medical supplies and resources.
What do you say to the critics who say, look, in a country of 1 billion, you have problems that can cause a lot of loss of life, infectious disease problems, lack of clean water. You're still dealing with some of the issues that are dealt with in developing countries. How do you justify all this?
I don't think that I'm in any way doing a disservice to this country. In a country of 1 billion people, we have to progress on both sides, on the social side as well as on the professional side.
Of course, no matter how far you travel for medical treatment, there are concerns, like post-op care, and also what your legal rights are. And there's no guarantee it's going to work out as planned. Nigerian native Fortune Ifijuku didn't need spinal surgery after all. That was a long trip, but the doctors in India determined pain injections alone would do the trick. But good news for the patient from Jordan. He says rehab here in India has helped him gain back sensation in his legs after a traffic accident left him paralyzed last year. As for Sandra, her surgery was a success. I had a look at her heart scans post-op, and the fibrillation gone. For now. After spending time in India, it's clear to me that the surge in medical tourism has only just begun. India is now among a growing list of countries competing for your business, competing to save your life.
The machines which are used in the US and here are just the same. Most of the people that work with us have been, at least at the physician level, have either been trained or have had exposure or had communication with doctors in the United States. We can compete with anybody else in the world.
And the rest of the world is taking notice.